Thank you. Time right now, 5:18. As we come to the end of November, some folks are also wrapping up a month-long public health campaign called Movember. It's when men grow or try to grow a mustache, is a reminder that all men need to pay better attention to their health. Well, Doug decided to join the Movember movement. Some of you even emailed us wondering about that thing on his upper lip there. So, Doug, you were pretty quiet about what you were up to, and now you're ready to explain to us a little bit.
The mustache thing didn't work out very well.
Yeah.
But as you know,
yes,
but a lot of other folks don't know, 2 years ago I was diagnosed with prostate cancer, and I thought sharing a little bit about my story and a lot about the journey of a Brookline man could prompt important conversations with loved ones and conversations that ultimately and hopefully can save lives.
I'm 61 currently, and this, for me, started about 2.5 years ago.
What first started 2.5 years ago for Jorge Fernandez was a life-changing diagnosis. At 58 years old, this married father of 5 from Brookline was suddenly facing the fact that he had prostate cancer. What was your first initial reaction when the doctors told you you indeed had cancer?
Yeah, so, it was a strange thing, and certainly a scary and disconcerting thing.
It was not only all of that. Jorge says the news also came as a huge shock. The reason?
I didn't have any symptoms at all. I really had zero symptoms.
It wasn't until Jorge's primary care physician noticed that his annual monitored PSA results, which is part of a routine blood test taken by men Jorge's age, came back a bit elevated. A biopsy confirmed this significant amount of cancer was present, and after consulting with his doctors and his wife, Jorge decided surgery and removal of the prostate was his best course of action.
If this would have been left unattended, then it would be a completely different, situation and probably a sad outcome.
Prostate cancer is remarkably prevalent. It is by far the most common cancer among men in the United States.
Dr. Mark Pomerantz is clinical director of genitourinary group at Dana-Farber Cancer Institute. He says cancer in that small gland that's located just below the bladder and is part of the male reproductive system is more common than we appreciate. And in most cases, if a man lives long enough, he may actually die of old age rather than from the cancer itself.
Most people die with prostate cancer, not of prostate cancer.
Even still, Dr. Pomerantz says 250,000 men will be diagnosed with prostate cancer every year. 30,000 of those cases will be fatal. And although it's the second leading cause of cancer death among men, early detection can be a lifesaver.
The number of diagnoses is much different than the number of prostate cancer-related deaths. And that is a reflection of how controllable and curable this disease can be.
So how you feeling now?
Great, yeah, I feel really, really good.
Currently, Jorge is cancer-free and living a full and happy life. And despite some men not wanting to talk about the sensitive nature of this type of cancer, Jorge says awareness and having what can be admittedly an uncomfortable conversation is critical to saving lives.
Even just doing this is not so easy. But I feel like it's important to, to confront it and to also know that avoidance or ignoring it or, just that would have been terrible for me and for the people that I love.
So Dr. Pomerantz says you can find inspiration in our female friends and loved ones who have made breast cancer awareness an important part of overall health care among women. He says the breast cancer movement has saved millions of lives, and there's no reason we can't do the same for men when it comes to facing and fighting prostate cancer.
And, you really said it there. It's something that's so hard to talk about, but so important that you're talking about it. And, maybe sharing your story can save another life out there.
When it comes to the downstairs plumbing, guys don't like to talk about that stuff. And sometimes you just got to have the conversation. So, we had a meeting and some of the female coworkers didn't realize that this was something that men need to check out as part of their normal routine. If you have family history, or you're African American, you should really start having those PSA, at least starting to track it around age 45, age 50 and older as you get, if you're not part of one of those high-risk groups. And
I was in the high-risk group because of family history. So.
And then a lot of our viewers might want to know where you stand in your journey.
Well, I'm in what they call active surveillance, which means I continue to watch that PSA level, and recently it started to creep up a bit more. So that means I have to go back for my 3rd biopsy, and they pushed it up 6 months. So in early January, I'll probably have another one, and we'll see where we stand and what is the next selection of choices within that process. So
we're going to talk about where that mustache went coming up in our next half hour.
Okay.
We'll be right back.